So transition is the last phase of labor. It's the fastest, most intense part of labor, and it ends when you are complete and ready for pushing and delivery, which is stage 2 of labor. You're ready to push when your cervix is 10 centimeters dilated and fully effaced. Before you push, you always want to make sure that you have the support of your healthcare team. Some women do feel the urge to push before they are actually 10 centimeters dilated, so just for safety, we want to make sure that the healthcare team is in support of you pushing. Pushing contractions are 60 to 90 seconds long, and they come every 3 to 5 minutes. So you do have a little bit more of a break in between those contractions than the transition contractions. Most women say that pushing contractions also come with a strong urge to bear down or push. So when you're ready to push, your healthcare team will help you into one of these common positions for pushing. Some women choose to push from a side-lying position with their support partner pulling their knee towards their shoulder to help open the pelvis. Some healthcare providers will allow you to push from a hands and knees position if that's what's most comfortable for you. Most women end up pushing and delivering from a semi-sitting position. The head of the bed is elevated. Your nurse or your support person will stand on either side of you and kind of bring your knees towards your chest as you curl around your baby and push with a really strong, all you have push from your diaphragm. You don't want to push with your face, which can be a tendency that we have. We bear down, we hold our breath, our face turns red, our eyes are bugging out, but that's not going to give you an effective push to help bring your baby down through the birth canal. You really want to push from lower in your abdomen with your diaphragm and with your abdominal muscles. Really bear down, grunt. Don't be afraid to make noise while you're pushing. Most women will push 2 to 3 times per contraction, and usually that's guided by one of the nurses on your healthcare team. She'll direct you to take a deep breath in, and as you exhale, really bear down and grunt as you are working to move baby through that birth canal. Pushing can take anywhere from a few minutes to a few hours. As you push, I encourage you to look in the mirror that's provided in your delivery room so you can see your progress. It's really encouraging and helps motivate you to keep going through the strenuous task of pushing. Eventually, you're going to be pushing and you're gonna see baby's head emerge through the perineum. And that's gonna be very exciting because you're very close to meeting your baby for the first time. When you release that push, baby may slip back up into the birth canal, but will emerge a little bit farther as you continue to push. And eventually, baby's head will stay out of the birth canal and held in place by the perineal tissue that is stretched taut around baby's head. That's referred to as crowning, sometimes as the burning ring of fire, because the perineal tissue is stretched so taut that it can have a pins and needles or a burning type feeling. With the next couple of pushes, your baby's head will fully emerge, and your doctor may suction the nose and the mouth to clear it of amniotic fluid and birth canal secretions so that they can take a nice full breath. With the next push, your baby's shoulder will emerge, and with that, the rest of your baby will slide out of the birth canal effortlessly. Your doctor will place the baby immediately on your abdomen, and a nurse will come with a warm towel, and they will briskly dry off baby. That helps them maintain their temperature. It also helps stimulate them to take nice deep breaths to really get oxygenated blood circulating through their body. Your baby may have a reddish or a purplish tone when they're first born until that oxygenated blood starts circulating. After about a minute, when the placental blood has moved from the placenta to baby, the umbilical cord will be clamped in 2 places. And the partner or a baby's father will be offered the opportunity to cut the cord between those clamps. There are no nerve endings in that cord, so there's no pain to mom or the baby when the cord is cut, and there's also no blood loss during that. After the cord is cut, the baby is going to be put skin to skin on mom's chest, and then you'll both be covered with a blanket to keep you warm. Having your baby skin to skin in that first hour after delivery is a great time to start bonding with your baby. Your baby is usually wide awake during that first hour, so it's a great time to start making eye contact and talking to your baby. Your baby will recognize your voice, will recognize your partner's voice, and so it really just helps to cement that bond of the three of you in a family. During that first hour of skin to skin, there are also some physical benefits for mom and baby. Having the baby skin to skin with you can help stabilize their temperature, their heart rate, their blood sugar level. It helps prepare mom and baby for first breastfeeding, which also happens during this time of skin to skin. Your nurse will help you get a good latch in a good position for you and baby to have your first breastfeeding experience during that time. Also, during your hour of skin to skin time, your doctor will repair any damage or tears to the perineal area, and also your placenta will be delivered. So 5 to 20 minutes after baby is born, you'll have another mild contraction and the placenta will be delivered. Your healthcare provider will examine it to make sure that it's healthy and intact and that it will be disposed of with the medical waste. Right after delivery, your body begins the process of involution, which is the process of the uterus returning to its pre-pregnancy state. This does take about 6 weeks, but the process begins right after delivery. The uterus begins contracting and shrinking and returning to its normal size, shape, and position in the abdomen. What questions do you guys have for me regarding pushing and delivery and immediate postpartum?
How do you know the appropriate time to cut the umbilical cord?
So delayed cord clamping is a common question right now. 1 minute is considered delayed cord clamping. That's considered enough time for all of that nutrient-rich blood from the placenta to flow to baby. They usually wait until the cord turns a white color, indicating that the blood has flowed through, which is about 1 minute. Other questions?
Yes, can the father also participate in kangaroo time?
That is a great question. Yes, fathers can participate in kangaroo skin to skin time. It's a great way for fathers to bond with the baby as well. And now you can start the fun and exciting journey of getting to know your baby.